Our studies into the use of psychedelic therapies for mental illnesses are well underway around the world. Here in Australia, the Therapeutic Goods Administration is currently considering whether to change the classification of MDMA and magic mushrooms from prohibited drugs to controlled drugs.
Dr. Stuart Saker is a psychiatrist who's advocated for the use of psychedelics in psychotherapy. He joins us now from Lake Macquarie in New South Wales. Stuart, great to talk to you. The TGA is looking at this very carefully. It's deferred its initial decision, and we should have a decision next month about this classification. What are they looking at? The risks, the benefits, and the evidence overseas, obviously, about the use of these drugs?
Hi, Bridget. Thanks for having me. There's very compelling evidence from overseas that both MDMA and psilocybin are effective treatments for major depressive disorder and post-traumatic stress disorder. Because they've traditionally been seen as illegal drugs, the TGA is looking at safety issues. We're pretty convinced about the efficacy of the drugs and the safety. There's clinical trials occurring in Australia already which replicate the trials overseas, but thousands of patients have been through trials overseas, and we think these are going to be life-saving treatments for patients with these debilitating and really high prevalence illnesses. And if these were new medications, and a drug company had a patent on these medications, they'd probably be the highest selling medications in the world. But they're old medications with stigma attached to them, and we've got to work through some of the prejudices against these medications and really rehabilitate them, so that we can save some people's lives.
Yeah, well, I was going to ask that because, I mean, obviously when people hear about MDMA and magic mushrooms, we know that the potential for harm there. How do you get over that perception, and what are scientists saying at the moment? Because there's a big gathering at the moment. Are there different views on how to communicate to the public about this potential change in classification?
It is complicated, and it's a good question, and we do have other analogues of medications that have been rehabilitated, and many thousands of prescriptions for medical cannabis occur in Australia. And several years ago, cannabis was a scourge also, and we seem to have gotten through that reasonably well, and that process through the Therapeutic Goods Administration of allowing us to, and the TGA already allows us to have permission to prescribe the medication under their, they call it experimental medicines code, the SAS Category B application process. But we can have permission from them on one hand, but we don't have permission from them on the other hand. And in terms of the risks, the risks are really overinflated, and in the clinical trials overseas, the risks are very much mitigated by having the medicine used in a clinical setting with professionals who are trained, doctors, psychologists, all sorts of professionals that I've worked with and trained with in Australia, and wonderful people. And part of the treatment is the medicine, but part of the treatment is the therapist too. And people spend time with some amazing people who are really dedicated about getting them well. And I think that instills a huge amount of hope.
Dr. Stuart Saker, thanks for joining us. It'll be interesting to see where the TGA lands on this one.